wasn't like, hey, you know what we're going to do? We're going to go, get ourselves into $500,000 worth of trouble, but we only have $70,000. It wasn't like that. Right. It was like you start off saying, how much is this going to cost? We need software that does this. How much is that going to cost, right? Oh, we'll put the whole thing together for $80,000, right? We'll get you a basic, working version of this, right?
Yeah.
For $80,000, right? $400,000 later, you still don't have it, right? And so then you're like, and as you're doing it, right? One, you have the optimism of the venture itself, right? We're going to get there, and it's always okay. Another month or two, we're going to get there. And so you're spending in the hope that you're going to get to the goal that you want, and then you're going to be able to do all these cool things, right? So all these bills are accumulating, right? And while these are accumulating, all your kind of savings, all our personal funds, everything else is just going into this, right? Just disappearing in any number of ways.
Welcome back to Dear Healthcare, It's You. Welcome back to Dear Healthcare, It's You. I'm here with Elisha Yaghmai, and my name is Joe O'Hanlon, and we're continuing to go down the story of Elisha's journey through his medical journey, becoming a doctor, and then also as we're in the story now, we're talking about as he was trying to start a telemed business and the hurdles that he's encountered. So if you haven't seen the past episodes, please feel free to catch up. They're all on YouTube and all the podcast platforms, so subscribe if you haven't. And we're going to take a step aside today, actually, from the actual practical parts of the story in terms of how it all played out, and we're just going to talk about the human side of it. Elisha, you at this point, we've talked about the insurance battle and how long that went through. So many hurdles that you had. You were not getting paid that whole time. You were just keeping this business afloat, basically. Is that accurate?
That's pretty much right, yeah.
Medicare was starting to pay at some point when you got the workaround, but the private insurance through how many years was it of
from 2014 to 2019, there was basically no private insurance payment, and Medicare had some payment structures which they created, but no one, for the first few years of the company, we had hired third-party billing services. They couldn't figure out how to bill Medicare properly for telemedicine, so we would send them claims and they would be rejected, and the billing company had no idea how to fix them and would just dump it back on our plate and say, sorry, your claims are rejected, we don't know what to do, it's your problem.
And so the hospital was, were the hospitals that you were working within during this time through the telemed process, were they getting payment for these patient services?
There were a variety of things going on. Some of them were collecting a little bit of payment for what was called an originating site fee.
Okay.
So some of the insurers, Medicare at that point, mostly Medicare, had decided that there was some technology involved in doing telemedicine, so they would pay something called an originating site fee, which was supposed to offset the hospital's cost to have the technology to do a telemedicine visit.
Which the irony being,
in our case, right, we were paying for it. We were giving them the technology for free, and we were running it for free. We were sustaining all the expense of doing that. So they were just collecting originating site fees against nothing. And we found out, some of the hospitals, for example, had started overcharging for the originating. So they were charging the patient a fee to see the doctor.
Yeah.
So not just being
an origination fee.
Not just being, well, they were getting the originating site fee, but they would, so let's say the originating site fee at that time was $20. So every patient that sat in the chair, they'd get $20. They'd charge the patient $70 to sit in the chair, to see the doctor, to then be billed by the doctor, right? So you can imagine, right, if you're a patient, you're like, why am I paying $70 to see someone and then be billed by them?
Right.
Not realizing this wasn't us at all. This was the hospitals. Some of the hospitals acting unilaterally. Yeah.
And then would you try to bill those patients
standard?
Standard fee, and then, but I'm sure a lot of non-payment because
the vast majority was non-payment. Yeah, it was just bills coming back unpaid, just outright denied. And then the problem we'd mentioned last time, which was that with private insurance, we couldn't even bill them because they wouldn't acknowledge our existence, right? By credentialing us to their panel, so we had no bill to send.
All the way.
We could send it, but they would just to say, we don't know who you are, right?
Right,
this
just
is zero.
Straight back. Yeah. So in this time, let's talk about just the stress on you. Obviously, I had asked this before, and so I know the answer is yes, but you had debt for this. I mean, did you start with medical school debt even? I mean, that's a place that a lot of people coming out of med school that I think a lot of us, we know that doctors have to charge a certain fee because it's like their education is so intense and requires so much payment for them to get.
That's right.
So you had medical school debt to start this all.
That's correct.
And your wife is a physician as well. So
Yep.
did she have debt?
She had
too?
debt,
So
yeah.
collectively, you guys had 2 doctor's debts. Did you have undergrad debt as well?
I did not.
Okay.
Yeah, that's one thing.
So had the med school debt, and then at what point did you have to start taking out a loan for the business?
Yeah, so there was a series of progressions. So initially, so to start, at the time this started, I think we owed, besides our house mortgage, which was already, that's one debt.
You had a mortgage in Seattle?
In Seattle, yeah. So
Okay.
we had that debt, and then we had medical school debt, which combined between the two of us was over $200,000. I think it was $230,000, $240,000, something like that we owed.
Yeah.
And so the very first choice in launching this whole thing was we had been saving money.
Yeah.
For years, since residency, since we started getting any kind of payment, we'd been saving money, and we'd saved up a certain amount of money, and the goal was to try to pay off these educational debts, right? To remove those things and just cut it down to just paying the mortgage. So the first choice was, well, we have this money in savings, right? Do we use this to pay down the educational debt, or do we use it to fund starting this venture?
Yeah.
So the vast majority of that money went to actually initially to fund the venture. So the very first thing that we blew through was just our personal savings. Like, it was gone, right? That was all gone.
And that was as the business was already up and running, or is that to like actually just get
it running? Because in the beginning, right, we didn't have anything. So all that technology we talked about, right, giving people devices for free, that money initially came out of my individual pocket, and then also the other people that joined in early.
Yeah.
Some of their money went into it too. The majority of it by a wide margin was mine.
Right.
But we were funding all of that, right? And then we started doing development of software. And the reason we did that was because the third-party software was not doing everything that we needed it to do clinically.
In terms of like the stethoscope and things like that.
Exactly, yeah. So at that time, like hooking a stethoscope into telemedicine software was not a commonly available thing at all, especially the types of software that were being used at that time. So we had to develop that, right? So there were software development costs that went into it, right? And in each situation, it was like a lot of things. It wasn't like, hey, we're going to go, get ourselves into $500,000 worth of trouble, but we only have $70,000. It wasn't like that. It was like you start off saying, how much is this going to cost? We need software that does this. How much is that going to cost, right? Oh, we'll put the whole thing together for $80,000, right? We'll get you a basic, working version of this, right?
Yeah.
For $80,000, right? $400,000 later, you still don't have it, right? And so then you're like, and as you're doing it, right? One, you have the optimism of the venture itself, right? We're going to get there, and it's always okay. Another month or two, we're going to get there. And so you're spending in the hope of that you're going to get to the goal that you want, and then you're going to be able to do all these cool things, right? So all these bills are accumulating, right? And while these are accumulating, all your kind of savings, all our personal funds, everything else is just going into this, right? And just disappearing in any number of ways. And it wasn't even just there. I mean, when we were starting out, for example, the legal structures surrounding all of this were very new.
Yeah.
Nobody knew how to set up. How do you do a telemedicine practice, for example? How do you do that? What are the Stark laws related to this? How does all the billing work? How do you structure these kinds of agreements with hospitals? Because it's different than what has been done commonly before. So you're spending a bunch of money on legal, trying to figure this out from scratch, right? All of these things are you're just hemorrhaging cash, basically.
Because it's not just starting a new business, which is always a losing almost always a losing venture at the start. Usually first 3 years you don't make a profit, but like you're having to be a pioneer for a brand new type of business.
That's exactly the thing. Yeah, it wasn't like we started selling sunglasses, right? Where everybody kind of knows what selling sunglasses is, and you just another entrant to the market. It's like in a lot of cases we're going there and saying, how do we structure this, right? And the attorneys are like, we don't know, we've never even seen this before, right?
Yeah.
We don't know. We have to do some research and figure this out. And then we're trying to create software structures in some cases which either didn't exist or pretty rare to find.
Yeah.
So then there's research and work that has to go into that. So it's a lot of that sort of startup and research and development cost, right, that goes in that just vacuums up, your cash.
Were you anticipating some of that, all of that? Like, was that a shock to you at some point to be like, oh my gosh, I thought we'd be making money by now? Like, was it? Yeah. What was that like?
The shock, I think, was, as I kind of alluded to in a previous episode, was that I didn't go into this sort of Pollyanna style, right? Like, it's all just all going to work out, right?
Right.
I went into it. I had set up I had multiple pro formas, right, where you lay out all what you think are all the details, right? Okay, so I went to research. Okay, so what are all the codes? How much does each one pay?
Right.
How many of these should we expect a day? How many people are there? Like in rural Kansas, how many actual people are there? Okay, what do we know about the need for this type of doctor relative to a population size, right? So if I have 100,000 people, how many rheumatologists do I need for 100,000 people, right?
Right.
I had researched all of this stuff, right? And I had it in these very extensive spreadsheets, which I did and then redid and then redid again and then redid again.
Right.
And I was estimating, 0.1% growth,
Right.
per time, several months or something. So I tried to be as conservative as I could be, right? And I was like, with all of that together, we should still make it. Like, even with these expenses, we should still make it. Like, all we need to do is just be able to send out our bills. And the problem came about because we couldn't figure out how to bill Medicare decided that for telemedicine billing was the way to bill them was the exact opposite of how every other Medicare bill was sent in. Meaning you normally would bill by where the patient was, like where they were located. Medicare decided for telemedicine, you bill by where the doctor is. No one knew this. So they're sending the claim in.
So unstandardized for one hospital.
They're sending the claim in, doing it the way they've always done it for Medicare, and getting denied, and not understanding why they're getting denied. It's because the procedure by which Medicare had chosen to pay these was different, or the information they were requiring was different than anything that had previously been done. So that was one. And then on the other side was, like I'd said before, you research out the private insurance policies and you say, okay, we check all the boxes, right? We should be good. And then you go there and then they're like, no, we don't want to talk to you and we're not paying you, right?
Right.
So then all of a sudden it's like, oh, okay, so we're seeing these patients and then there's $0 coming back. And then we have committed to the physicians saying, we're going to pay you, right?
How many physicians did you
I think at that point, we had 25 specialties when we started, right? So there's a lot of people, right? And what we were doing was we had said, hey, this is a startup venture. We don't, it's going to take a while for people to adopt it. So give us availability. We will pay you to be there. We're not paying you per click, which is what a lot of services do. We're not paying you per click. We're going to pay you for your time. So if you sit there for 4 hours and nobody shows up, we will pay you for 4 hours, right?
Is that like a clinic model, basically?
Yeah, it's a clinic model. This is what we went with, right?
Yeah.
So here again, right, we're rolling this out, and then, some people are coming, and then they can't get paid for any of that, and then, then the hospitals are doing their hijinks with whatever the fees to see the doctor, right, and trying to exploit that, so then fewer people are, all of this is happening, things that you couldn't necessarily anticipate.
Yeah.
And so the cash is just flying out the door, right, with no revenue coming in against it, even though theoretically there should have been.
And you were working in this venture full time at this point as well, right?
No, so to start it was a side venture. Okay. I was still working a medical job, like I was working an employed medical job. What happened was, as the savings all went away, right? Then what happened was basically all the money that I was making from my real job, all of it was going not to the family bank account, not to anything. It was all going into the business, right? So all of that was there, and then on top of that, that still wasn't enough money. Right. So then I was moonlighting, right? So I was basically taking up side jobs, like side hustles on top of my medical job, right? I was doing all this stuff.
On top of your medical job and your other
medical job /
side
So I'm doing the administrative side, trying to run this business, right? I'm doing all the sales calls. I'm driving all over the place, flying all over the place, trying to sell this thing and demonstrate this stuff.
And that's while you're still in Seattle. You're flying to Kansas and then driving all around.
Flying back and forth.
Recruiting.
Driving all over. Doing all this kind of crazy stuff. I'm doing all that, working my full-time job. Also have side hustles going on. And this went on for years, right? And all of that money.
All those years?
So I flew back and forth. Yeah, so we came back to Kansas in 2015, right? So 2014 into the last quarter of 2015, basically, we're still coming back and forth from Seattle.
Right.
Right. In 2015, we were living in Kansas again.
Okay.
So at least I didn't have to do the flying, right? But I'm still driving all over the place, trying to run the business, trying to set up all these other structures that you need to run a business, trying to set up all the clinical aspects of what's going on, right? Doing all of those things, and then also doing a full-time medical job, and then also moonlighting on the side, and all that cash is just dumping into the money pit of the business. Yeah.
Were your partners in similar positions? Were they also like just not profiting off of it at all and just giving everything?
They weren't profiting. Yeah. So they had put in, each one of them had put in a fixed amount at the beginning. Yeah. The ongoing cash outlays basically were mine. Like that was my responsibility. So they had, I think, different situations. So each one was in kind of a different place in terms of where they were in life.
Yeah.
But long story short is they kind of put money in, and then that was more or less the end of their financial contribution. Gotcha. They were still helping out in other aspects of the business. There were lots of other things that were going on. There was quite a bit of work that was going on, particularly on the technology side, right?
Yeah.
things like that. Sometimes on the sales side, right? So
Okay.
people were putting in effort in those ways. But financially, the bulk of the weight of that sled was mine.
Yeah. Did you feel alone in it? Like, in the
Initially,
weight of
no. Initially, no. As things got worse and worse and worse, yes. Yeah. I would say, certainly, as we got to kind of the worst times in it. Yeah, at that point.
I mean, like, you were doing so much too, which even for just one physician job, like we've already talked about, often it sounds like there's overwork involved to do it to the due diligence point that you like to do it to and feel compelled to do it to. So, like, how much were you sleeping?
Like during work weeks, 2 hours a night.
2 hours a night?
Yeah, yeah. I would work.
How are you functioning?
It's a good question. I mean, optimism and...
No, but I mean, for real, like, was it...
No, it was challenging. It was not easy.
Like, would you have a day off and then just have to sleep the whole day?
No,
or
no.
There
weren't days off. There weren't days off. It was just, you just grind it out and you grind. And I mean, the motivation at the time, thinking back on it, besides the general insanity of it, was, hey, we have a goal. I mean, like I mentioned before, right? At that time, we were looking at it like, we solved this access thing, right?
I was going to say, you felt very, very convicted that it was for the better good of the whole system that you were working for.
That's correct. Like. Yeah. And that, I mean, that is, I think anybody that's been in that position, I think, can testify to it. It's very motivating, right? And you find out in those situations what your capabilities are. Like when you're really motivated, what your capabilities are, right? And it was that kind of thing where it's like, on the one hand, it's miserable, it's horrible. On the other hand, it's like, well, I'm trying to drive toward a goal that I think is useful.
Right.
And that will get you through a lot. That will get you through a lot.
Which, as you've talked about in many different forms throughout our time together so far, like doctors in general, many of them, a stereotype that you've put forth is that, there's a level of achievement, like that's a thing that you chase. And I think that that's a true thing for our human capacity is that many of us don't know how much we can achieve because we won't push ourselves into the discomfort or the the extreme realms that you're talking about. So I do understand that it can be quite compelling to those that want to see how much they can accomplish. Is that somewhat like you started your journey wanting to go into international medicine based on your time that you had in West Africa?
Yeah.
And I don't know much about your chapter in West Africa, how extreme or non-extreme your circumstances were there, but obviously in many, foreign settings for medicine, there's a lot of need and a lack of resources. So there's a lot of stretching.
Yeah.
Is that something was it like fulfilling something in you that had been there this whole time, that you'd wanted to stretch yourself this thin?
I think on a personal basis, I have always been I'm not motivated by fear.
Yeah.
That's right. So I'm motivated in a positive way, right? I have to love the thing, right? And so on a personal basis, I think it was so much of medicine prior was obligatory. Right, it's obligatory, and it's.
And what do you mean by obligatory?
You have to do this, right? You have to take this test.
Okay.
You have to pass through this rotation. You have to do this thing.
I see.
You have to do this to get to the next thing, and then you have to do this to get to the next thing, right? And then suddenly, in this period, it was like you don't have to do this.
Yeah.
But I wanted to do this, right? And I want to do this because I feel like it actually makes a difference, right? So it's kind of taking all that. Problem-solving impulse, right? And this is in a lot of ways, this is kind of the tragedy of modern American medicine, right? We take people that, on average, reasonably intelligent people, they like to try to solve problems, right? And we paint them into these really tiny boxes, and we put all these constraints around them, right? And then we're like, why are you unhappy?
Right.
Like your joy is to go fix things.
Yeah.
We're not going to let you fix anything really, right? You can only do it within these limits and at these times and in these ways. And this was like, hey, all that's off, right? This is, we're trying to do a thing that is not really been done.
Right.
We have to figure all of this out from scratch, right?
So which in itself, I think, to you sounds like it was exciting at the onset, at least.
It was,
And then now when we're talking about, in the midst of it, you getting 2 hours of sleep,
Mm-hmm.
I'm imagining your health was declining
Mm-hmm.
in ways that
Yeah.
you maybe could notice, maybe couldn't.
Yeah.
And some, like, were you eating healthy stuff to help you sustain?
Was
Or?
I eating is probably the question. Yeah, a lot of times
Yeah.
no. I mean, I'd go the whole day and not eat anything. I mean,
Yeah.
there was no time. I
Because
mean,
like that sounds so much worse
Yeah.
objectively
Mm-hmm.
than some of the things that you have rightfully so
Mm-hmm.
labeled abusive
Mm-hmm.
tactics or expectations that you experienced prior in
Yes.
different settings.
Mm-hmm.
And then this was you imposing this need on yourself
That's
in
the
some
difference.
ways.
Yeah.
And that's where it sounds like, you found something you believed in enough
Mm-hmm.
to make you want to push that hard.
Yes.
And to make it worth it.
Mm-hmm.
But was there ever a point that it felt like it was not worth it?
There were times when I think the question I had was, I think to this day, I'm like, I think this is the right thing.
Yeah.
Maybe I have just come too early.
Yeah.
Like this is just, and that happens, right? Right
Yeah.
idea, wrong time.
Sure.
The problem, and the funny thing is, right, you read business literature, product market fit,
Mm-hmm.
timing. The smart thing to do from a business perspective was to look at it and say, man, we're a little early, let's cut our losses, right? We'll just go back and wait, right? Maybe we'll reincorporate something in a few years and try again,
Yeah.
right? But the problem with it was that mixed into that, and this is the soul of the issue, right? Mixed into that business imperative was the medical imperative. We know that we can fix a serious problem in healthcare.
Yeah.
We know this. How do we pretend we don't know, right?
Right.
So how do we go back to the line?
Yeah.
And keep doing what we've been doing when we know that we could be doing better than that, and that there are real people who will be harmed by our failure to stick this out? That's, you know what I mean? That's just psychologically, it's a very different position to be in.
Right.
And that was part of the problem here, right? So how do you quit that?
And pretend like you don't know it.
And pretend you don't understand what you have done, right?
Yeah. Can I ask this question, and you can feel free to say no, but did you deal with depression during this time?
No. No, I wasn't depressed. I was angry a lot.
Yeah.
but at the circumstance, you know what I mean?
Yeah.
This just very, why is this so hard? It shouldn't be this hard. It shouldn't be this, why are we having to fight these people to try to help them save money, right?
Right.
Those kinds of things were going on. But no, it wasn't a depressing thing. I mean, it was, again, that sort of,
like you had that mission, that fire,
there's a
the
mission
inside of you.
Yeah, which I think people need. That's one of the things I realized from this. I was like, you need it. You need some kind of meaning in your life, right? And this supplied that to some degree.
Yeah, which is really interesting to hear, because just on a side note, I mean, you started this saying that you didn't really have much thought about going into medicine. It was just kind of like the hierarchy of education, and so you just went that way, and you wanted to help in some way, and that was a practical way you could help. And then through this chapter, it sounds like that's really what helped solidify, was like you pushing yourself or being pushed to such a far extent of just stretching yourself so thin. But you needed to find that thing that you were like passionate enough about to do that for.
I mean, to kind of go sort of back to what that drive was. So at one point I realized, okay, we're not able to make any money doing virtual visits, right? So, but they'll still pay us to do in-person care, the traditional model. So one of the problems, which we talked about in a previous episode, right, that a lot of the little rural hospitals had, was trying to transfer patients out. Very difficult process, lots of phone calls, lots of phone tag, waiting around, getting punted, getting excuses, right? So I came up with the idea of something called the Rural Transfer Service. And the purpose of that was basically to make it easy for rural hospitals to transfer patients. And the reason was we had admitting privileges at some of the hospitals in Wichita. So
what does that mean, admitting privileges?
We had the ability to admit patients to the hospital and care for them there, right?
Okay.
We didn't have to ask someone else to do that, right? The rural hospitals, the providers out there don't have those privileges. So they have to call the big hospital and say, will you please accept my patient? And they can say yes or no, right?
And just because of your former relationships and or current,
we were living in the town,
there,
right? We had all the qualifications to be able to do this, right? So we had those privileges. So the thought I'd had was, well, wait a minute, why don't we just start doing this. Like, rather than when we were caring for people virtually, sometimes they would need a bigger hospital due to
Right.
whatever was going on, and we would have to call, and we'd go through the same song and dance and games that we had
Yeah.
already experienced. So I had the thought, well, you know what, we need money. We need to
Yeah.
get some revenue in here, and seeing patients in person, they'll pay us for that. So why don't we start taking that on, right?
Yeah.
So basically, rather than having to call the hospital and go through all this stuff, just call us, tell us about the patient, and we'll handle it from
Yeah.
there. We'll get them admitted. We'll do all the back end work for you, the rural hospital, so you don't have to do this, right?
Yeah.
And that worked.
Were
It worked.
many of your doctors actually
A few,
in
no,
Kansas? Or?
none of my partners were here. There were a few other docs that were working with us.
Okay.
I mean, that's not correct. I'm sorry. One of my partners was here. The rest were not.
Okay.
But there were other docs that were working with us at that time.
Yeah.
One doc had recently joined us to do this. So this process starts, and we start bringing in patients. Shortly after this, we had one of the worst flu years that we'd had in like a decade, right? So tons and tons of people were sick, hospitals were full. It's crazy high volumes and high acuity. So during that period, I mean, again, it was getting increasingly difficult to get much help, right? So
Yeah.
I was doing the bulk of these. So these admits would come in, I would go round on them, see them, take the calls, do all these kinds of things. And when you have patients in the hospital, right, if you don't have coverage, you take the call 24 hours a day, right?
Yeah.
So no matter what's going on. So there was one period where I did 72 hours straight, right, of just just new admissions coming in, right? And it was like
72 hours straight.
I would finish one, and then another one would come, and then another one would come, and like as I finished each one, the next one would come, and the next one would come, and the next one would come, and I just went for 72 hours, like nothing. I was just clinical care for 72 hours all the way through. And over the years, after that, I mean, I had runs of 60 hours, I had runs of 50 hours, right, where I was just doing this stuff. And here
Do you
again,
feel like that was wise?
no, it was terrible. It was
Okay.
terrible. Yeah, and I mean, there's periods of time where I can't quite, like thinking back on it, like it's hazy, like my memory is
I would
hazy.
guess so. I mean, they say that sleep deprivation has the same, at some point, it has the same effect
It does.
as drunkenness.
Yeah, it
like-
does. Yeah,
yeah.
it does. That research was less well known at that point, but I mean,
Yeah,
I could have
sure.
told you subjectively. I was like, yeah, this doesn't, I don't feel good.
Right,
So,
right.
so I had, episodes like that. I mean, I was having chest pain, like, all this stuff was going on, and I'm trying to, do all of this. And again, why am I doing this, right? It was not because, it is like I'm making tons of money and I love making money,
Right.
right? It was like because we need this to be able to buy another device to send out to whatever place, right?
Right.
But we need this to be able to pay our staff for another month.
Right.
This was the motivation for that kind of insanity.
Yeah.
Which, I think thinking about it now, I probably would try to find another way to do. But it wasn't like I didn't. It wasn't like I was asking for help. I was trying to find other things, and there was no help coming, right?
Right.
So it was like either you do this or you don't. But
Yeah.
but either you're like it's on you, right? Either
Yeah.
you're going to do it or you're not. And if you don't do it, then this is over, right?
Yeah.
So that
And so
was
was
the
that
choice.
was that
Yeah.
the thing with your partners where it was that they were drawing boundaries for themselves?
Correct. Yeah. Mhm.
And you could have drawn those boundaries, but it would have meant the closing of the chapter.
That's right. That was it. Yeah, this was going to be the end, right? And there were a lot of episodes, I'd say, here again, why did we continue? Besides the sort of the mission of the stubbornness, there were just weird things that would happen. Like we would get to like the end, we're like there's no more cash.
Yeah.
There's, the debts are too high.
Yeah.
And then something would happen kind of out of the blue. Like there was one, we were about dead, and I met, at some event, I met a doc that was working. He was working in rural. He was like managing rural hospitals, right? And I forget how we even started talking. We struck up a conversation. He was like, this sounds really interesting what you're doing. Maybe you could help us out, right? And this ended up leading to an agreement, right? And that agreement came like within a week or two of when it was like this was going to be the end, right?
Wow.
And that kind of thing kept happening. Right. The way I described it a lot of times, it was like we were kind of code blue, right? And we were about to call it and say, this is the end.
Yeah.
And then, all of a sudden, like the pulse would come back.
Wow.
And that happened 2 or 3 different times, right?
Yeah.
So again, you can kind of, call it what you want it. It was like, this keeps almost dying, but,
Right,
but
yeah.
not dying.
Being resuscitated.
So
at the
maybe we
last
need
minute.
to keep it going, right? We need to take this as a sign that we're doing something that we should be doing. You know what I mean? You can kind of get it, interpret it in whatever way you want to, or maybe it's just random luck, whatever it was.
Right.
Random bad luck, actually, given how it went. but that was part of it also.
Yeah.
So anyway, so all that's going on within the. Oh, go ahead.
Can I ask? I mean, about like you're married at this point and have a child,
Yeah.
right?
Yep.
And now have another
Second
mortgage,
child,
I guess. Oh, a second child by then.
Yeah.
And you're living in Wichita, another mortgage here, then
Mm-hmm.
all this debt.
Mm-hmm.
You're sleeping 2 hours,
Yeah.
so I'm guessing that there's not a ton of family time.
There's not. No, it's terrible.
I mean, that's a huge component when we talk about, mission versus like what's most important in this life. And I think that there are people that feel such a vocational calling so intensely, or it's that the circumstances demand it for a time and we understand this won't be this way forever sort of thing. And that sacrifice is given. But also we know that early years of development for kids are something you can never get back.
Right.
Your relationship has strain, debt, and overwork are two of the biggest factors of divorce. And you're still married to the same woman. You still have these kiddos.
Yeah.
Like, is there a personal side that you regret in this chapter?
Yeah, I would say. I mean, a space of a few years. I mean, I was more or less absent.
Yeah. I mean,
like,
that's what I'm assuming had to be.
Even more absent than during residency or whatever. You know what I mean?
Yeah.
Like I worked harder on this than on anything ever.
Yeah.
Anything ever, which includes all the medical training, everything else it didn't even come close. Actually, residency wasn't even in the same ballpark of severity as what went on with this.
Yeah.
So, I mean, during the worst of it, 110-hour weeks, probably something like that. That's just the work, right?
Yeah.
Never mind whatever else you have to do at home and all those kinds of things. Easy, that much time. And that went on and on. And again, why did it go on? In part because there was always this, well, like tomorrow will be better, right?
Right.
Next month will be better.
Yeah.
Right?
And then those little glimpses of hope,
Yeah, and you have this, right? And you're like, oh, okay, just push it a little bit longer, right? And then you look back and realize it's been 3 years, right?
Right. I mean, and then ultimately 5 years is a long time to hemorrhage money and life.
Yeah.
Like, was it worth it?
Was it worth it? That's, I think in the end that's more of a long-term judgment.
Yeah.
Even to today, I don't know.
Yeah.
The value that I see on a personal basis was learning what my own limits and capacity are.
Yeah. How much sleep do you think you need now?
Less than I thought. But I mean, all of that. I mean, it had additive effects. Like it came. You don't go through, even physically. You don't go through that. I wouldn't recommend it. Like you don't go through that without. There's a toll to pay.
Yeah.
Which I to a large degree. I mean, I experienced. It was like that.
Because I mean, we can jump to the current 2024 is when we're filming this, and you recently. Not to be the spoiler alert, we'll talk about it in a later episode more in depth because we're still talking about the story of how this has gone through. But Free State's clinic that has been a physical clinic here in Wichita is closing. And in your letter that you sent out to patients announcing that earlier this year, you mentioned still pulling like 19, 20-hour days.
So that had improved, and then it went back to that. Right?
Yeah.
And this time around, I think I learned something from the first one, which was that I can do this. But also I need to be sure that what I'm doing is the right application of this amount of effort.
Right.
And we can talk about the reasons why this time around I did not think that was true.
Yeah.
But at that time and at that stage of life, I thought it was. To give another example, just from the physical perspective, like when I started, my hair was brown, right? It got like this in the space of about 3 years.
Really?
Yeah.
During that era?
Yeah.
That's interesting. Yeah. I mean, we see that in presidents all the time in the 4 years.
Now when I look, the before and after photos, and I'm like, that's real. Like, because I wasn't running the country, but I had the same.
No, I mean, under
the same
extreme
physical effect.
duress of, an extended period of time with no let up. Yeah. Do you have a savior complex?
It's an interesting question.
Like, have you ever, I don't mean that to be a gotcha question, but do you feel like that's something that you like have to battle and like be aware of in yourself, or?
I think it's the, what do you call a savior complex? I don't know. I mean, it's an innate need to solve issues. Like,
you would
I
be open to do it with a team, though. It doesn't have to just
no.
be you.
It doesn't have to be me. No. In fact, in every case, actually, I try. To mobilize a team to come in, right? The difficulty is that not everybody has the same personal motivation. They're not in
Right.
the same circumstance of life, right? They
Yeah.
have a different philosophy about how they want to do things, right?
Right.
Increasingly, I'd say people have ideas about what their boundaries are and what they're willing to do, and they're not willing to go beyond that, right?
Right.
Doesn't matter what it's for. They're not willing to go
Mhm.
beyond that. I mean, all those things are there, right? But no, it didn't have to be. It didn't have to be me.
Okay.
And it wasn't.
Do you ask yourself sometimes, like, why is it at the end of the day just you?
Yes, I have. I have asked those questions. I think there's different reasons for that. I mean, I think it's I think in this specific case, I think the issue was this: the task was difficult.
Yeah.
It was increasingly hopeless.
Mm-hmm.
Like, in other words, when you start a business, for most people, your goal is to come in, you put something into it, you do some work, right? Eventually you start seeing a return, right? Or you don't, and you say,
Right.
okay, right, I'm done. It's not necessarily, there's not a philosophical component to it.
Right.
You know what I mean? Like, it either works or it doesn't.
Right.
And
I think cut your losses and
you move on,
to the next,
right?
Yeah.
And I think to some degree, psychologically, I think a lot of the other people that were involved kind of got to that, right? This is not going to go anywhere, right?
Yeah.
So we'll cut our losses and move on. I think that was part of it, right? So it's that.
Did they not feel the same compulsion that you did about like not returning to the way things just were before?
No, and I think that even in the ranks of medicine, right? That's not a uniform feeling.
Right.
My problem is that I like to try to get to the essence of things.
Yeah.
This is that's not just medicine. Anything. I try to get to the essence. Like, what really?
Right.
What is this thing? What are we all doing here?
Yeah.
Why are we doing it? What's the point of all of this? And so the problem that I had was that as we got deeper into it, like my level of horror began to increase, because every layer down we would go, it got worse.
Yeah, you kept uncovering more and more problems that
Yes.
you were seeing.
Yeah, and then it's like, oh, okay, so these problems are more extensive than we thought. We need to do a little bit more. Oh, wow, it's even worse than that. We need to do a little bit more, right? And I think here again, it's a difference of personality. My approach to it was, as things got worse, it's like, well, but we can't just abandon this, right? We have to keep chipping away at this.
Yeah.
And I think for others, it was more like, oh, this is even worse than we thought. Okay, well, that's confirmation, right?
Right.
Time to get out of here. Like, I'm not gonna kill myself for this, right? I'm just gonna go do something that is good for me, or good for my family, or financially better for me. You know what I mean?
Mm-hmm.
I'm gonna salvage myself.
Right.
Right. I'm not gonna sort of set myself on fire so that we can try to warm up this problem. Right.
Right. Like, you had found that, I think, in finding that mission, it sounds like there are people that we read about in history, and there's many that we don't ever know their names of, but they're the ones that, like, work-life balance is for most people. Mm-hmm. And then there are those that have a vocational or other calling. I don't know a better term for that, but it sounds like that's really the essence of, like, you really discovered and converted to your mission, almost like your calling in this chapter.
Yep, I would say that's true. Yep. As we ran out of money, we did two things. One was we tried to raise money. So we talked to investors, and people put in about $600,000 at the time.
Was it a nonprofit to start?
It was not. No, it was started as a for-profit venture. So we went to try to raise money from investors. This was kind of the early stages of this. Almost all that money went to just pay accumulated debts, right? And so then it was necessary to take out a loan, a small business administration loan. And probably the first serious fracture that occurred with the partners was we needed actually about $900,000. We could only get $6. We could only get $6 because I was the only one willing to sign for the loan. If the other docs had signed on, we could have gotten the money we needed. So we got $600,000. So to do that, I had to sign away everything we owned as collateral. Yeah. So that was an experience. So I went to that banking meeting. I had my newly born daughter with me, and I was signing an agreement saying, basically, if we fail to pay this, like, y'all own everything we have. Wow. And I did that there by myself, right? Knowing that there were other people that could have signed on to this thing who refused, right? Who refused, even though I had actually said, look, I'll sign a side deal with you that I'll pay the payments on this. I will pay your portion of the payments if you'll just sign on to this thing so that we can get the capital that we need to actually do this, right? So we couldn't get all the capital we needed. We couldn't get that amount.
That amount was what you needed to get out of debt at that point?
No,
or
but
to
the
get you into
900,000
the
was what we
black?
needed to get us to pay our debts and also enable us to do the things we needed to continue to grow
Right.
the business, right? So we weren't able to get all the way there. So it was a weird feeling of saying, I'm signing for an amount that I know is not enough to get us over the top. Our life is still going to be very difficult. I'm having to sign over everything I own solo to guarantee this loan. None of my partners are going to help me, even when I've agreed to pay their payments for them.
Was that a hard ask to, I guess maybe we don't want to put this in, but like as far as your marriage, to ask your wife to do that?
My wife was like
was she on board?
amazingly okay with it. Yeah.
Yeah.
And you know, here again, so for people that, you know, so my wife is a physician, right? So then a lot of people's response, oh, well, your wife's a doctor, so everything's fine. No, so all my money was going into the business. And then on top of like I didn't have any money left to pay the loan payment, right? So then what was happening was money that she was earning, which was supposed to cover family expenses, was also going to pay the payments on this $600,000 loan. And this isn't $600,000 in 2024.
Also a partner.
That's right.
Like,
you know, this is $600,000 back in 2016, right? In 2017, right? That's a substantial amount of money, right? At that point in time. And this is, you know, and all of this was going to, you know, try to fund this, fund this whole thing.
Yeah.
So
does she believe in it as much as you do?
I don't know if I could say she believes it. No, she's less sort of idealistic, I think, than I am. I think she just viewed it as like, this is the thing that I'm working on, and she was offering support. You know?
I was going to say she's supporting you as a person.
Yeah, she's offering support for me to do this thing that I felt was very important, and I was putting all this energy into.
Yeah.
And as often happens in these situations, right, she was carrying a lot of the load, right, in terms of the kids and various other things that are going on, and also working. Right, while I'm, you know, burning myself to dust trying to do this at the same time. But I don't think I could have done that if she wasn't stepping into that role. It was not possible to do.
Yeah, you could have had a lot more personal struggle and suffering in this chapter without a supportive partner in that mix, for sure. And it's not a rosy story. We don't have an ending. Like, it's not solved. All the things that you were trying to.
It's not solved at all.
It's been, you know, we're farther down the story, but that's a unique part of our story right now, is where we're not trying to just tell your story and then there's a nice ending, or even just a tragic ending. There's not an ending still. We still don't know what will happen next. So, well, we'll get back to going through the story and the plot kind of points that we've been doing, and we're going to dive into lobbying, what that lobbying process looked like next time, because you guys were doing lobbying with the insurance companies, and that's something that, you know, I don't know that many of our audience or myself have a ton of knowledge around, and so we'll dive into that, some more of the specifics next time. But thanks for talking candidly about just the struggle of it all.